Hi, I'm Jeremy O'Connell, co-founder and chief scientific officer at Juvena Therapeutics, and I'm excited to share with you today some of the progress our team has made in developing a new investigational protein drug for the treatment of myotonic dystrophy. Some of the statements about that progress are forward-looking and should be interpreted as such. At Juvena Therapeutics, our mission is to rejuvenate lives, medicine for movement. And we're doing this by unlocking the therapeutic potential of the proteins the stem cells in our bodies make to coordinate the repair and health of tissues throughout the body. By developing a proprietary platform that allows us to map the contents of those stem cell signals to their regenerative properties in order to understand where the best therapeutic application of them lies. In doing so, we've generated a growing pipeline that addresses major unmet medical needs in metabolic and muscle health. I'm excited to share with you today some of the progress for our lead program, a drug for treating muscle weakness and wasting called JUV161 that we're advancing into first-in-human dosing later this year, aimed toward the treatment of myotonic dystrophy. We've developed this drug to be broadly available to tissues from a subcutaneous administration and have strong preclinical evidence that demonstrates safety and the reversibility of aspects of muscle wasting and weakness. In myotonic dystrophy type 1, an expanded CTG mutation in the DMPK gene disables the function of that gene and the protein it would normally produce, and instead produces toxic RNA hairpin. This RNA leads to stresses within the cells, particularly muscle cells, that respond with an inability to take up and utilize energy for muscle fiber formation and the generation of strength or endurance during normal properties. This is called a loss of cellular homeostasis, where cells have a reduced capacity to respond to insulin to take up energy from their environment and to use that to fuel the formation of new fibers and the generation of muscle strength and function. So that collectively, this presents in the clinic as muscle wasting and weakness, respiratory defects, and myotonia, symptoms of myotonic dystrophy. To combat these aspects of myotonic dystrophy, we've created JUV161, a signaling fusion protein. And I'm showing you here an illustration of that drug, which is a protein, here demonstrated as a model with atomic level resolution of the backbone of that protein threaded against one of its receptors. This protein is a combination of one of the common carrier proteins in human blood called albumin, transports nutrients, and one of the drivers of muscle fiber formation during embryogenesis called IGF-2. Together, they become like an insulin for muscle, restoring the ability of muscle cells to take up energy for their environment and gives them a signal to grow and proliferate that allows these muscle cells to survive, differentiate, and produce strength properly. We've developed this into a drug that can be subcutaneously administered from a simple injection as one would with insulin. Here's some of the data that gives us conviction that JUV161 will successfully translate into the treatment of myotonic dystrophy. When we take cells donated by persons with myotonic dystrophy and grow them in a dish, you can see an example of what that looks like in this image on the left. The blue dots each represent a cell, and as the cells mature, they begin to express some of the proteins necessary for muscle formation, highlighted in green. As the cells mature, they fuse together into new fibers, which are formed of many muscle precursor cells. You can see in this example, not many cells survive, and few of them manage to succeed in forming new muscle fibers. However, when treated with JUV161, far more cells survive and far more form new, mature, large muscle fibers. As we quantify these changes between untreated cells, or those that would be like a placebo control on the left, here shown as the red bars on the right, we see that treatment with JUV161, the blue bars, have significantly better survival and new fiber formation. Importantly, When we test in mouse models of myotonic dystrophy type 1, here we see the mice lose strength week over week, showing a decline in roughly 8% in muscle strength, measured as the grip strength potential in these mice by the third week. However, treatment with JUV161 not only halts the decline, it enhances the strength above the baseline level. Collectively, these data give us hope of reaching our goal to restore normal function to muscle cells in people afflicted with myotonic dystrophy. Administration with patients may lead to improvement in the ability of muscle cells to survive and form new muscle fibers. The metabolic and structural properties of those fibers formed, and resultingly, improvements in strength and endurance capable of being produced from these muscles. Collectively, we're optimistic that if such achievements can be realized, it will lead to an increase in the mobility of people with myotonic dystrophy, and thus an increased capacity for social participation and an improvement in the quality of life. We're excited to begin dosing first people with JUV161 later this year in a study that will explore the safety and tolerability of JUV161 in healthy volunteers. In addition, we'll understand how the drug distributes and is metabolized by the body, and how the body responds to it in various ways, and which markers we can use to track the progress and response during treatment with JUV161. Zooming out one level to the longer-term study, we will first attempt treatment with JUV161 in healthy volunteers, following treatment of JUV161 in healthy volunteers, where we understand safety, tolerability, pharmacokinetics, and markers of the body's response to treatment. We will then advance to treatment in myotonic dystrophy type 1, in initially a proof of concept and then a pivotal trial to assess the improvements in muscle mass and muscle function over the course of treatment. As these studies progress and we gain additional conviction on the application of JUV161 to improve these important aspects of muscle strength and function, we will begin exploring additional indications where JUV161 has the potential to help people, such as myotonic dystrophy type 2, SMA, or sarcopenia. In summary, we're excited about entering the clinic in 2024 with JUV161. It represents an orthogonal approach to the treatment of myotonic dystrophy 1. As a natural signaling molecule that can drive muscle cell differentiation, survival, and strength, developed into an easily administered subcutaneous injection, similar to the insulin of muscle. We have strong preclinical safety data that gives us a first look into the anticipated human exposures needed for efficacy, at which doses we see well-tolerated and rapid-acting effects. Finally, as we look forward toward these clinical trials, we are excited to continue interacting with the Myotonic Dystrophy Foundation community to understand how we can minimize patient burdens and design trials that are representative of the community as a whole. We've enjoyed many of our interactions in past conferences and meetups and appreciate all of the feedback we have garnered there and look forward to many of the discussions we'll have in the future. Thank you. And please follow our progress at juvenatherapeutics.com.